Hello, my name is Amy Alexander. I am the Executive Director and co-founder of the Refuge Center for Counseling. And we are a Christ-centered nonprofit counseling agency located in Williamson County, but providing services to individuals and families in 17 counties across Middle Tennessee. We do all of this on a sliding fee scale so that counseling sessions can be affordable and accessible to all. And we wanted to take a few moments to reach out to you and really acknowledge you as faith leaders in this community who have a tremendous voice of authority. Engagement from faith leaders around mental health and even things like ending suicide in our communities is entirely necessary given the season that we are in. Churches generally have tremendous impact in terms of their mission programs, which focus on the least, the last, and the lost. For today's training, I would contend that our buildings and services are filled with people who look fine and seem great, but feel like the least, the last, and the lost on the inside. Marital crisis, anxiety, panic, addiction, loneliness, and grief. These are the issues that are every bit inside our church walls as they are outside our church walls. Every person in our world has suffered at some level this year. Not one of us could ever have imagined the amount of loss, uncertainty, powerlessness, and isolation we would experience. And for all that we were experiencing on the outside, we were also experiencing it on the inside. People have been desperate to find meaning in all of this, desperate for hope. With the added stress of this year, there has been an acceleration in the mental health crisis in our community. What this meant for the Refuge Center was a 22% increase in requests for services. We hear from people every day who are struggling, teens who are battling an eating disorder, self-harm, or suicidal thoughts, grieving families who've lost a loved one, couples whose marriages are in trouble, individuals coping with addictions that were a coping mechanism during the crisis. People are sharing that anxiety and depression have skyrocketed. And for some, they say that this year reminded them of past times they felt alone or triggered by old wounds of helplessness. So unaddressed, we know that these things, 6 months, 12 months, even further out, they result in divorce, panic attacks, toxic reactivity, which we see so often in social media, depression, and even suicide. In our community of Franklin in 2020, we saw a 42% increase in suicides from the prior year. Every suicide in 2020 in Franklin was a male. In Williamson County alone during 2020, 93% of suicides were men. We know that men are increasingly burdened by the pressures of success, achievement, and performance while fearing failure and feeling alone. But no one should struggle or suffer alone. The work we do now to come together is more critical than it ever has been. Some people think of mental health that it means someone's broken or having a breakdown, and it's up to all of us to normalize and humanize it. Mental health is our emotional, psychological, and social well-being. It's how we handle our stress and relate to others. I heard it said once that mental health is the little voice inside your head that's been talking to you for as long as you can remember. We all struggle with that voice at some point or another. It says things like, I've let people down, I've failed, or I'm unworthy. And knowing that we will all struggle at some point in our lives because this is the human condition, supporting mental health efforts becomes important to us all. So I'd like to give you 7 things that your church can do pretty immediately to make a difference in this effort. The first thing is QPR, or mental health first aid trainings. Okay, so most of us would know how to help someone who is having a heart attack. We'd start CPR, or at the least we'd call 911. But few of us know how to respond if someone's having a panic attack, or we think they are showing signs of self-harm or addiction. QPR stands for question, persuade, and refer. This is a 60-minute training that can be done online or in person, and it's completely free. It gives you questions to ask if you are concerned that someone's not in a good place. It gives you the steps to encourage them to seek help, and it gives you the referrals to help them get the support they need. The second thing you can do in this first segment is mental health first aid. This teaches you how to identify, understand, and respond to the signs of mental illness or substance abuse disorders. It takes the fear out of starting a conversation and gives you an action plan to help people safely address these pain points. When people are equipped to start a dialogue or to even listen better, this can save lives. Mental health first aid is an 8-hour training. It can also be done in person or online. The second thing your church congregation can do is to offer mental health talks or Q&As. These could be done as a live session for a small group or in a Sunday evening, even a Sunday morning. They might focus on things like trauma, depression, marriage, grief and loss, or struggles with media. The Refuge Center would be very glad to come and provide these for your congregation. The third thing you can do is promote Find Hope Franklin. This is our mayor's initiative to address mental health in our community. Find Hope Franklin is a community-based resource with a mission to reduce the stigma associated with mental health and create an environment where anyone can feel empowered to ask for help. We want Franklin and beyond to be a safe place emotionally and mentally, a place where people can say, I'm struggling and I need help, and a place where our citizens know how to say, where does it hurt and how can I help you? When individuals and families can access supportive resources, it improves the whole community. If you go to findhopefranklin.com, you will find crisis lines, counseling centers, medical centers, psychiatric hospital information, and many online resources that makes it very easy to find hope and help. So consider promoting findhopefranklin.com on your church website or in your weekly bulletin. The fourth thing you can do is to support the work and initiatives of local counseling groups. Here in Franklin, we have many wonderful groups. I might mention, of course, the Refuge Center for Counseling, Mercy, and Insight. You can provide funding for your congregants to get mental health support, perhaps paying for their first 6 sessions or paying 50% of their care if they could not afford it otherwise. You might also see your local counseling agencies as missional in nature and therefore consider putting them on your missions budget, especially if they're offering a sliding fee scale and do need to offset that with the funds and care of the community. The fifth thing you can do is open up your space for local support groups, grief and loss groups, sexual trauma groups, men's emotions groups. You can create space on a weeknight or even weekends for support groups to be hosted in your facility. The sixth thing you can do is to continue to decrease the stigma through shared related resources in your bulletins and social media accounts. I can't emphasize enough having a suicide hotline readily accessible. And today I will give you that number. It's 1-800-273-8255. 800-273-8255. Finally, get the support that you need. Every leader, every pastor and minister needs a safe place. So that's the phrase we use here, do your own work. This is not intended to be a laundry list of things added to your plate. It's about living from a place of fullness and spaciousness so you can offer love and care out of the overflow. It's about you being the healthiest you can be spiritually, emotionally, and physically. Leaders need leaders. You need people around you who can ask you hard questions, give you feedback, challenge you in your blind spots. Research says we need 4 to 7 iron sharpens iron people in our lives. At different seasons, this could be a counselor, a spiritual director, a pastor, a small group leader, a life coach, an Enneagram teacher, someone in Celebrate Recovery or AA. It's also about the ways we're learning and growing, reading and podcasts and daily practices like the Examine. But the truth is, leaders have to embrace and model this first. We can't give what we don't have, and we can't give help if we're not asking for it. We've got to be safe and secure for ourselves before we can offer that to others. So as a recap, 7 things your church can do right away. Offer a QPR or mental health first aid training for your congregants as well as for your leaders. Number 2, offer mental health talks and Q&As provided by professionals. Number 3, promote Find Hope Franklin, findhopefranklin.com in your materials. Number 4, support the work of local counseling groups. 5, offer space for local support groups in your building. 6, share that suicide hotline. And 7, get the support you need. Thanks so much for taking time. And the refugecenter.org or info@therefugecenter.org. We are so glad to provide groups, trainings, again, QPR and mental health first aid, anything we can do to create conversation and increase emotional safety in our communities.